African mentality is like when you want to see a pharmacist, it's just about drug.
It's not every time you walk into the pharmacy that you get medication.
As a pharmacist, is it every time you prescribe drug?
They're professionals, so when you walk into a pharmacy and you lay your complaints and we don't see any need for a medication, we won't recommend a medication for you.
Someone wake up around 1 a.m. or you prepare some more and the pharmacy did not even say anything about this thing. He just said I should eat and take my medication.
Okay.
So what advice do you have for people eating late night food?
Mostly advice on lifestyle modifications.
Okay.
Your dietary modifications. Don't eat this, eat at a specific time, don't eat at this time of the day.
So lifestyle can affect someone's health.
Yes, definitely. People that have hypertension now, for instance, we advise them to reduce their salt intake. People that are obese, down the bigger side, we advise them to jog, do activities because of the cardiovascular.
Do more cardios and
so
take a walk. Don't just sit in
don't just have a sedentary lifestyle. Don't just sit in the morning. You sit, you don't move, you don't do anything. So we advise on that. So now it's left to the person, to that individual now to say, okay, you've told me this thing. Should I do it or should I not do it? Hi everybody, my name is Naija. I'm a pharmacist.
Welcome to the show, ma'am.
Thank you very much.
How are you doing?
I'm fine, thank you. How are you?
Yeah, I'm fine. Why do you choose to be a pharmacist?
Okay, so I chose to be a pharmacist because I want to be involved in the healthcare practice, but not necessarily confined to a particular role. So I would want to be able to tell people how to take their medications, what it does for them, and what to avoid while on certain medications.
Oh, and you really enjoy the work?
Yes, I do.
Well, what are the biggest misconceptions people have about taking prescription drugs?
Okay, so I'm going to explain with an example.
Okay.
Yeah, so let's say Mr. A is having cough, catarrh, and headache. She goes to a pharmacy and she gets some specific set of medications, and then we're in the same house and I have the same symptoms and I go, oh, because A took this and this and this, it works for them. And I go back to the pharmacy and I'm like, give me those particular medications. Most people go as far as bringing the packet and, oh, this is what my friend bought, it worked for them, so I have to get the same medication. Most times when you have the same symptoms, we have different body and different thing works for us. So I would prefer you come to the pharmacy, lay your complaints and ask for recommendations. Don't assume that what works for my friend has to work for me.
Because we have different body physics.
Yes, we do.
Wow. I'll pick the question from your last question.
Okay.
What are the challenges you people face out there as a pharmacist?
There are many challenges we face as pharmacists, but then it still sums up to the whole idea that people think everything works for them and they don't adhere to instructions, mostly lack of ignorance or for the fact that they do not understand better. And because of the way the world is busy, many people fail to ask questions, so they just feel like, oh, I've taken this medication before, so I know how to take it, don't worry, don't tell me about it, I can take it, I know how to take it. But most times, because you're on other medications and you do not know if they have any contraindication, you have to ask. So for every medication you buy from the pharmacy, even when you assume that you know about them, still ask questions to know better.
How do you handle patients that take a lot of painkillers and antacid? They believe so much that, you see, once I take the painkiller like this, my body will now calm, I will enjoy myself, I'll be able to concentrate.
You don't just take medications because you feel a certain symptoms. Now you can tell me you have headache now, and the first thing I'm going to tell you is drink water. And check if you feel better after a few hours before you go to medication. So you don't just take medication for every symptoms that you feel. Yeah, let's say you have headache and every time you're taking paracetamol. Let's use the simplest explanation of paracetamol. Now, do you know that paracetamol can lead to liver problems when taken in excess? Now, you don't take medication just because you feel like you have access to them. Pain medications are there to be taken when there is pain, not when you feel a little bit of discomfort here and there.
I like the fact that you talked a little bit about the paracetamol, because the way people take it these days is alarming, like very alarming. Small thing, you want to take paracetamols and the rest. Yeah. What are the truths about expired medication? Are they safe or risky?
Drugs are poison is a common knowledge, yeah? So let's say drugs are less effective when it's past the expiration date, most especially antibiotics. So I would not advise anyone to take an expired antibiotic. So before you take any medication, check if it's expired or not.
once they give you expired medication, you should try and check, or any medication, just try and check
for the expiration date.
Okay. What are the questions the patient should ask a pharmacist?
Okay.
Why going to a counter? Yeah, what are the normal?
Dispensary.
Okay.
Okay, so first question you should ask is, what's the name of the medication you're giving to me? What's it used for? Are there going to be side effects? Every drug definitely has side effects. So what are the side effects that are associated with this particular medication that I'm going to be taking now? And you go as far as asking the dosage. How do you take it? If I'm taking other medication, should I take this? If I'm eating a particular food, are there things to avoid while I'm on this medication? Because there's something we call drug-food interaction and drug-drug interaction. So you ask for, oh, I'm on this medication. If I take it with this medication, is there any interaction? Does something go wrong when I take it with this or that? So you're supposed to ask these questions to be abreast with what you're taking.
Out there, we see a lot of people combining different medications together. Now maybe they're taking one analgesic, and you as a pharmacist, you don't know, and they will not tell you, patient will not tell you they are on one medication before, and they are telling you that, you see, I'm still feeling pain. How do you undo that kind of case?
Okay, first off, when you walk into a pharmacist will definitely ask you, what drug are you on? What drug have you taken for this condition? They're always going to ask you. Now, it's on you now to provide those information, because they are very, very necessary. So there are medications that you shouldn't take with other medications. For instance, let's use the simplest example, antacid. Antacid should not be taken with other medications. You have to give like a space of 30 minutes to an hour. So you give time space before you take these medications, because they have what we call drug-drug interaction, like I said earlier. The end point is, ask your pharmacist. They are more knowledgeable on drugs, so you ask them every question that is related to your medications.
Okay, well, what are the roles of a pharmacist to mental health? In a situation where you have patients that look more disturbed, they are not organized, you notice stress.
Okay.
How do you help patients like that?
First off, make them feel comfortable.
Okay.
When anybody feels comfortable, they tend to relate more, they tend to share more insights on what they're going through. So make them feel comfortable, make them feel at home, give them a listening ear, try not to interrupt them where they are telling
expressing themselves.
Yes. And then reassure them. They might be on medications for an extended period of time. People on hypertensive medication, for instance, they may take, it's a lifetime medication. So after a while, they'll be like, I'm tired of this drug. Every time, every day. You just have to reassure them that, oh, it's for a lifetime, but it helps you feel better. When you're alive, you can live better and play other roles in your life of your kids and all of that. So reassure them that everything is going to be fine, they're going to be okay, and it's just a matter of time.
It's just close your eyes and open it, you're fine.
And
it's just like
okay.
that.
Yes.
Yeah, like the issue you're passing through is just
a phase,
yes. And it's normal. It happens to everybody.
I think saying it's normal or it happens to everybody is like invalidating their feelings. You don't get to tell them that it's normal, it happens to everybody, because it's not happening to you directly. Maybe it happens to someone you know. But then you just reassure them that you're going to be.
But can you give different cases for the person to calm the person down?
No, that's like giving a sub story. I don't think it's professional for you to use another person's medical condition as a reference to someone else's condition, because yours is more serious than mine doesn't invalidate mine. Yeah. So I feel like you just encourage them. Oh, it's a matter of time. Oh, you can come next week. Just make them feel like their family. Come next week, let me check your BP for you personally. I'll check it for you myself. That way they feel closer to you. Oh, come next week, I'll check your blood sugar myself.
See as a friend.
Yeah, get my number. Call me when you don't feel comfortable. Just reassure them that you're just a phone call away and they can always reach out to you. So that way they feel like they're talking to their friend. They don't feel the burden of, oh, I'm talking to a pharmacist and oh, it's a medical problem. They just feel like they're communicating with their friend and they're going to feel lots better.
You have patients that are not feeling fine, and you said maybe something came up and you're like, you're facing your own, and the patient is now being nagging. You should be able to
separate your emotions from work.
Okay,
you should be able to tell yourself that, oh, I'm at work and I have to be at work. Then afterwards, you can go to your house and feel the way you want to feel. But as long as you're at work, you're responsible for everybody. You deal with life, so you don't get to say 5 minutes time, I won't attend to anybody because I'm going through a heartbreak or I'm going through emotional crisis. No, you're at work, so you have to keep your feelings in check. Your emotions is different from your work life.
I like that. As a pharmacist, is it every time you prescribe drug? Is there no other way you notice that this person don't really need drug?
Not it's not every time you walk into the pharmacy that you get medication.
Okay, I love that, because the African mentality is like when you want to see a pharmacist, it's just about drug, all about medication.
We are not useless men and women. We are professionals. So when you walk into a pharmacy and you lay your complaints and we don't see any need for a medication, we won't recommend a medication for you. Because of the stress level in the country currently, people are going through stress. Most times they just need someone to talk to. If you remember earlier, I said, when you tell me you have a headache, the first thing I'm going to tell you is drink water and relax. So most times you're just going through stress and you don't know how to unwind or feel better. So most times when you tell me you're having a headache, I'm not just going to say, take paracetamol. I'm going to say relax, drink water, stay for a bit, watch it. If you don't feel better, it's when we recommend the medication. So it's not necessary that every time you walk into a pharmacy, we're trying to take your money. No. Sometimes we're just there to listen and encourage you.
Yeah, I love that. So because a lot of people be like, pharmacists, once you go to their place like this, they will write a lot of things for you.
That's not true. It's just a misconception. It's not true.
I love that. When next we're going to see a pharmacist, we'll know how to arrange our body very well.
Yes.
How can a pharmacist help people? Because Africans were fond of eating anyhow. What can you say about eating habits? Like someone wake up around 1 a.m. or you prepare semo and apple. At the end of the day, they just taking it that the pharmacy did not even say anything about this thing. He just said I should eat and take my medication. Okay. So I can eat anytime. Some people eat 2, 3. So what advice do you have for people eating late night food?
We mostly advise on lifestyle modifications.
Okay.
Your dietary modifications. Don't eat this, eat at a specific time, don't eat at this time of the day. We advise on that. So
lifestyle can affect someone's health.
Yes, definitely. So let's say people that have hypertension now, for instance, we advise them to reduce their salt intake.
Okay, I like that.
People that are obese, down the bigger side, we advise them to jog, do activities because of the cardiovascular. It helps with your cardiac.
Do more cardios and
so
take a walk. Don't just sit
don't just have a sedentary lifestyle. Don't just sit in the morning. You sit, you don't move, you don't do anything. So we advise on that. So now it's left to the person, to that individual now to say, okay, you've told me this thing. Should I do it or should I not do it? Pharmacists normally do home calls. Most times they call you and check on you. Have you taken your medications? How are you feeling after this? Lifestyle modification has a lot. Most times you're taking medication and you're not working on that medication. You're not working on yourself. The medication is doing half the work.
Eating habits, drinking habits, and stuff like. So when you have a patient that take a lot of alcohols and the rest, and some people will still tell you that, doctor, can I use beer to take the drug?
You tell them no. Most times, right, you just advise them. It doesn't stop there. Tell them what it will do to them when they take alcohol with their medication. Tell them what is going to happen to them afterwards.
The reaction. So
they'll learn from that. So most times you just tell them, don't take alcohol.
Why? That's it.
So I told them, don't take alcohol because this will happen to you after that. They're getting more information and they feel more inclined, so they won't do that. I
don't take like 3 bottles, so I'll not be fine. No. Me, I like it to take a sort of chilled one. When I take it at night, around that 8, 9, I'll start to swell my energy. I'll be able to sleep. I'll relax myself. Some people will still tell you that the doctor told me that I can take 2 sticks of cigarettes.
You're stressing your liver. It's not going to happen today. It's not going to happen tomorrow, but along the line,
your body will start piling it up.
Yeah. So when you're finding difficulty breathing, what we don't do in Nigeria is we don't do checkups. So you don't even know when you're sick or when you're okay.
You're fine.
The only time we go to the hospital is when we feel like, my head is spinning. It has been paining me for 1 week now. I still don't feel good. So we don't do checkups. So you don't even know when you're okay or when you're not okay. So my advice is going to be that you should not take alcohol. But it's still on you, like I said. So now listen to what I have told you and practice it.
Yes.
Because we all need to be alive to enjoy the money that we're working for.
How often can someone go for general checkup? Is it every week? Is it once a month? Is it quarterly? Is it once a year?
Every 3 months.
Every 3 months.
Yeah.
So because our body is just like a vehicle.
Same when you ride your car, you don't use it every day and you don't check it. It's going to just break down on the road. It will not give you warnings or anything. But for your BP should be checked weekly. If possible, every 3 days. Yes, you should check your BP regularly.
What advice do you have for people above 45, 50 and they notice that their BP is going up or coming down?
reduce the intake of red meat.
Okay.
Now you can go for substitutes like chicken, fish, turkey. Yes, you're going to say it's expensive, but then your health is worth, right? So reduce the intake of red meat. If possible, stop alcohol. 1 drink in a month is okay. Stop alcohol, because as you're getting older, your liver and your kidney are not the same as it was when you were younger. So smoking, try to avoid smoking. Then most especially portion control. Now let's say you're someone that is diabetic now.
Okay.
You wake up in the morning and you want to eat rice or bread. Now they're going to tell you to avoid those food, but since we're Nigerians and we cannot avoid them,
we cannot kill ourselves.
That's where you now come with portion control. I'm not saying do not eat rice at all, but limit the quantity you're going to eat in a day.
It's not like 3 cups and
no. So limit the quantity you're going to eat in a day. I know you're going to get hungry with time, but look for healthier substitutes for those things you're removing from your diet, like in place of eba, you're taking yam flour, amala. So but I'm not saying now because you're taking amala you should eat a whole bowl of amala. Portion control, that's where it comes in.
Just to reduce the quantity.
Yes, you have to reduce the quantity. Yes, you're still going to feel hungry, but you have to manage yourself. Yes.
So what of people that love party? So some people believe that, okay, since I take my medication, I can eat anything I feel like eating. Fried rice, they'll move to where they're serving jollof rice, and they'll be like, oh, okay, there's amala over there. Since they said food is drug. But
we said it earlier, the drug does half of the job. You yourself, you do half of the work. If you eat everything on the table, how do you manage yourself? How do you keep track of the calorie intakes you're having? So you're not supposed to eat everything on the table. At least minimize what you put into your body. As you grow older, everything that goes into your body should be checked. You should watch what you eat. You're not going to eat like a 20-year-old. You're not going to eat like a 30-year-old. Even from 30, you should be watching your diet.
As you're growing, everything about you is growing with you.
Yes, you should watch what you take. Your body is not the same way it was a few years ago, so you should watch everything that comes into your body, everything you drink, everything you eat, anything that goes into your system, you should watch it.
What advice do you have for your younger colleague?
My younger colleagues, school is going to test you. Pharmacy school is going to make you feel like it's a lot and you can't pull through, but you're just going to have to remind yourself that it's just a phase. It's something that you want, so you have to work towards it. And the profession, you learn every day. So you're not expecting that when you come out from school immediately you're going to know everything. You're going to take it one step at a time.
Start building yourself.
You learn on the job. I'm not saying we learn on the job, so you should be relaxed and not try to research on yourself. But every day there's a stepping stone. So every day, just take it upon yourself that, when I get to work today, I'm going to read on diabetes and know the drugs that work for diabetes, drug interaction. But every day you learn on the job. So don't be pressured. Feel relax, not too relaxed, but be relaxed. Look for something that makes you happy, because the world, like we said, you said earlier, you mentioned mental health. You have to be intentional about your mental health. So look for easy alternatives that will make you feel okay and still involved in the profession. So take it a day at a time. Read, enjoy the profession as much as you can. You
are in position of power today. What are things you're going to do better in health sector?
Okay, so I'm going to use a popular saying: you can't pour from an empty cup. I'm going to be more intentional about the healthcare professionals first, because they're the first line of action. If they're not okay, I don't think they can make people okay. So I'm going to be intentional about their well-being, check that they're not overworked, check that they're happy where they are, they're comfortable, there's a resting time. Most of the factors that healthcare professional face is that there's no time for them to rest. You can see someone eating and they're calling them to come and attend to a patient. So they're overwhelmed. Yes, I'm going to try and remove that pressure a bit from them, make them feel happy again while they're on their job. They're underpaid and they're overwhelmed. That's a whole topic for another day. And then I'm going to check the cost of drugs.
It's killing.
Now, there's something I'm going to say, right? People go to the pharmacy and let's say they know a branded drug. and they request for that particular brand of drug. Now a pharmacist goes, because they know that, oh, things are hard in your pockets. Maybe I've told you the price of this particular brand of medication you want, and I go, oh, it's 40,000 naira. You're like, oh. And you're going, like, no, there are other substitutes, there are generic brands that don't do the same thing. And you're insisting on that particular brand. Now, generics and branded medications, they do the same thing.
Okay.
The only difference is the manufacturer.
The name.
The name. I made this drug, you know me. I'm making the same drug. What you're checking is the composition of the drug. Are we having, is it the same thing in these two different medications?
And it will serve the same purpose.
It's serving the same purpose, and it's cost effective. So don't say because, oh, I want to buy this particular brand and they don't have it, or they have it and it's so expensive, I will not take my medication. Look for substitute or cost-effective brand that are good for your pockets. You can tell the pharmacist, there's no money, this is what I have. There's always a drug that will fit your pocket. So try to ask questions, interact with your pharmacist. They are just like you, they are humans like you, they talk to you, they are people like you that feel, that are going through the same phase with you, so try and communicate with them. So what I would do better is improve the cost implementation of medications, because people are not taking medications, or they are skipping their medications now because
of the costs.
And just try to make everybody, the healthcare practitioners and the patients, more comfortable.
You've given us the insight that there are times you go for a particular brand, and your pocket is not smiling.
Go for generic.
So there are other ways you can talk to your pharmacist that this my pocket is empty.
Yes, no.
Give me alternative and you will be fine.
Give me a substitute, because it's not really an alternative. It's the same medication.
Yeah, I guess. But the name, people can be like, oh, if I don't see that one.
Most times the pharmacist will obviously still explain to you that, oh, it's the same thing, but people are,
they will not listen.
They won't listen. They'll tell you, oh, it's that particular brand. But I feel like people should listen more and try to understand that, oh, we're trying to help you because you cannot handle this, is why I'm giving you this. So you'd still be okay while not breaking your bank.
Wow. Thank you very much to our viewers. We really appreciate you watching this program. Out there, when you see a medical professional, let's appreciate them. They are doing a fantastic job. We cannot do it. We cannot do it. So when you're going to their side, appreciate them, because they are humans like us too. Don't come and carry the trailer of your own stress and come and join it with their own stress. They are doing a good job for us. Don't forget to subscribe to our YouTube channel, Naija Health Doctor. Make sure you follow us on all social media, Facebook, TikTok, and Instagram. Remember, your health is the greatest asset you have. Thank you.